I'll start off. I guess for tonight, I'll start off, and then we'll have Sameera describe what we did, and Myron to share the findings, and then we'll come back and wrap up, and do a question and answer. So you can start first. As is the custom in Australia, we acknowledge the first custodians of the land. So I acknowledge the people of the Eora Nation as the first custodians of the land on which I work. I pay my respect to elders past, present, and emerging, and any elders who might be present today. So what we do today, as I said, we'll present the rationale and objectives, the methods, the findings, conclusions, and have a Q&A. Next slide, please. Firstly, some definitions. The title for today is Toolkits for Implementation and Evaluation of Digital Health. And the question is, how good is the evidence? So we did a review to do that. So firstly, a definition, a toolkit. This is based on we looked at the literature on toolkits and tools, and we thought we'll adopt the definition by Agency for Healthcare Research and Quality, organization based in the United States of America. They define a toolkit as a collection of related information, resources, or tools that together can guide users to develop a plan or organize efforts to follow evidence-based recommendations or meet evidence-based specific practice standards. And a tool is defined as an instrument, for instance, guidelines or checklist that helps users accomplish a specific task that contributes to meeting a specific evidence-based recommendation or practice standard. In this case, we're talking about toolkit for implementation and or evaluation. Next slide. The rationale stems from looking at what's available and the WHO stable. I guess the starting point for most people in this audience, in the AeHIN group, would be the WHO International Telecommunications Union National eHealth Strategy Toolkit. It outlines, and that was developed and published in 2012, and outlines a national strategy on development, implementation, monitoring, and evaluation. And then other public and private agencies develop country or domain-specific toolkits to support the harnessing of digital health interventions to strengthen health systems to achieve sustainable development goals. So with that context, some of the examples include the COSA eHealth Toolkit by the European Coordination Committee of the Radiological, Electromedical, and Healthcare and IT industry, and the Global Digital Health Index indicator guides, and lots of others, but it'll become apparent as we go on how we actually screen them out. Significant resources are needed for the production of such toolkits, and there are lots of them around, as I've said. The question we need to ask is, how useful are they? Are they actually helping or doing any good? Next slide, please. So the objectives for this topic, Toolkits for Implementation and Evaluation of Digital Health, is essentially to describe the current state of the literature. What are the purposes of these toolkits individually? What's their usability, relevance, utility, validity, whether they actually meet the quadruple aims of health projects and health programs, and whether the toolkits are actually widely adopted and widely used for projects for which they are designed for. And then secondly, the more important bit is to describe the evidence base of the toolkits. Next slide, please. And I'll guess with providing that background, I'll call upon Sameera to describe what we did in terms of trying to meet or answer those questions posed. What are they? How useful they are, and what's the good evidence base? Thank you, Sameera.
Thanks, Teng, and good evening, everybody. Thanks for joining in. So I'll just take everyone through the methods of the systematic review that we did. And we did them accordingly as per the PRISMA guidelines. PRISMA stands for Preferred Reporting Items for Systematic Reviews and Meta-Analysis. And so the inclusion criteria for the review we did was that we included toolkits of which were used for implementation and or evaluation of digital health interventions, and they should have been tested and or evaluated in real world practice, and they should preferably have a reported underlying conceptual framework or a logic model or based on a theory or a theoretical model. So, and we excluded records that were not published in the English language, and we excluded conference abstracts and reviews, and also for the purpose of this review, practice guidelines of any sort, and any checklists for practice guidelines or purposes other than implementation and evaluation of digital health were excluded. Next slide, please. Thanks. So we searched these five scientific databases: Global Health, Scopus, ProQuest, Web of Science, and PubMed. And the search was done in July 2019. And we also did a Google Advanced Search and retrieved any relevant toolkits or records that we found in the first 10 pages. And then we looked at different websites, and this list, as you can see here, it is a good list, but it's not the only list of websites that we looked at. So we did a very thorough gray literature search, and the bulk of our findings in terms of the actual tools or toolkits, they came from all the gray literature. So starting with the WHO institutional repository, and the ADB website, Measure Evaluation, Health Data Collaborative, for example, and as you can see, all the ones that are listed on the slide, and some others as well, as we came to know of different sources. Next slide, please. So this was the group in terms of the search strategy, the search terms that we included. So in the five databases that I mentioned in the previous slide. So we grouped these together and combined the 6 groups with and did a comprehensive search. Next slide, please. So then after we downloaded all the records from the databases and the ones that we got from the gray literature, everything was imported into EndNote so that they were in one place. And then all the collated records were uploaded to a software used for systematic reviews. It's called Covidence. And so that we had a single literature corpus in place. And each record was screened by title and abstract, and then as well as the full text of it was screened by 2 independent reviewers. That is the at least 2 among the 4 of us. And any disagreement was resolved by discussion with a 3rd reviewer of the team. And data extraction was performed independently by Myron, Teng, and I. And we 3 verified all the extracted data after it was collated. And what we really thought about when while we were extracting data and after we had collated all the extracted toolkits were whether there was a development and testing process described in the toolkit or any other paper or attachment related to that particular toolkit, and what was the purpose of the toolkit, and was it evidence-based, and was there any sort of underlying theoretical framework or model, and was the toolkit evaluated in real-world practice, and what were the lessons learned from implementation and or evaluation of these toolkits. And now Myron will take us through the results, essentially what we found.
Yep, thank you, Sameera. So to quickly summarize, our searchers threw up 1,380 records, of which 64 were gray literature and 11 were hand-searched journal articles. We uploaded these to Covidence and excluded duplicates. There were 57 of them. That left 1,323 records, which were screened for title and abstract. This process excluded 1,219 records, leaving 104 full-text articles for assessment. This assessment process led us to exclude 84 full texts. The reasons were that 28 toolkits were not relevant to the implementation and or evaluation of digital health interventions. 39 were not field tested or evaluated. 16 digital health intervention implementations did not use a toolkit, and 1 was a generic guidance on digital health evaluation. So in total, we included 16 full texts, from which we identified 13 toolkits. This is because some of the full texts were examples of implementation or evaluation case studies of the toolkits themselves. And so we collapsed these to 13 toolkits. So here you can see our results. These have been sorted by the year that they were conducted in. So starting off with development and evaluation of eHealth implementation toolkit back in 2010, conducted at the University College London. Around the same time, we had the PRISM framework, which was being developed and tested in Uganda. After that, we had the National eHealth Strategy Toolkit, which Professor Teng has already mentioned was released in 2012, followed by the MAPS Toolkit, which focused on mHealth. There's also a focus on health information systems and the assessment of national health information systems in Europe, and then toolkits for evaluating person-centered digital health and wellness, and Professor Teng's own informatics capability maturity of integrated primary care centers in Australia. This was followed by toolkit in health information systems, assessment, more work on the eHealth literacy assessment toolkit. Again, more work on the PRISM toolkits. So various toolkits or tools under the PRISM group of toolkits. And then toolkits in health information systems, interoperability maturity. And then finally, most recently, the toolkit on the state of digital health. And this is related to the Global Digital Health Index. So to sum all of this up, we found that all of the toolkits that we ultimately included reported their development process. Yeah, all of the toolkits reported their development process. All involved expert consensus. All of them had been through field testing of some sort or the other. All of them, not all of them were evidence-based in that they contained a prior review. 9 had a involved a prior review in their development process, and 4 did not. Only 1 toolkit did not report an underlying conceptual framework. 3 of them cited the use of normalization process theory. Most of these frameworks and toolkits into their origin in the UK. And 3 of them cited the WHO ITU eHealth strategy as the underlying framework. Regarding the purpose of the toolkits, 7 of them focused exclusively on implementation, 11 on evaluation, and 5 focused on both implementation and evaluation. 7 of them had evidence that they were evaluated formally. So screening process, we also identified 4 toolkits that we considered to be of relatively high quality, not able to formally include because they were not field tested, as you can see in this table. 3 of them did report their process. 3 of them also reported the use of expert consensus, and 2 of them were evidence-based, in that their development process involved a literature review. Those 4 toolkits we've outlined here. One was a toolkit on digital health innovation. This looked at navigating from concept to clinical testing, but it didn't look at scaling up or implementation, and it did not specifically look at evaluating that implementation. There was a toolkit for mental health implementation, but this was not, there was no evidence this was formally tested. A framework for national e-health evaluation and monitoring from the Karolinska Institute in Sweden, and also a National Health Information System assessment tool from the Health Metrics Network, which is very reputable, but we did not find specific evidence that this had been tested and or evaluated. And now I'd like to hand over back to Professor Teng.
Okay, I guess, thank you, Myron and Sameera. I guess when we're trying to look at, and we're still looking at the data iteratively, we looked at the factors intrinsic to the toolkit, right? Validity, relevance, utility, usability, and the complexity of the toolkit and how complicated it is. And we looked at whether it was implementation or evaluation, obviously, and whether it actually used which different theoretical models, including the AeHIN framework and the normalization process theory, which was well tested very early in the piece in University of Limerick and so on, the UK-based changes. And obviously the most current model of behavior change views to try to understand how these implementation toolkits work. Next slide, please. Next slide. So what makes a good, so some clear messages coming through. What makes a good digital health toolkit? The first, I guess, attribute is the purpose has got to be clearly defined and specified. And the development process has got to be well described so that others can actually understand how to use it and how to adapt it locally to the cultural and local context. So the participatory process with the intended users is important, the needs assessment and the expert consensus, local experts consensus as well. Evidence-based, that's a given, and it has got to have some sort of literature review and has got some past studies either involving the tools or the toolkit itself that has been tested and experimentally and can be found in a literature review. Field tested, as Myron pointed out in the findings, is a key kind of attribute we use to include the toolkit. So that has got to be a minimum of pilot testing and may or may not be an implementation, but at least a pilot testing. So we set the bar very low. And it has to be kind of, the evaluation has got to include whether they were fit for the purpose that they were designed for. And I guess like most interventions, and we see a toolkit as an intervention, whether they had any unintended consequences. And some of the work we did in the Pacific with the maturity assessment models and the toolkits that's been used suggests that one of the unintended consequences may be cognition and the cognitive load. So next slide, please. So the take-home messages. Okay. So the take-home message from this, and now we want to leave lots of time for discussion. There are lots and lots of toolkits out there, and also quite a lot of them for implementation and or evaluation of digital health interventions. Very few report any evidence base. Very few report being field tested or even pilot tested. And even fewer are reported as being formally evaluated. So based on our experience with this literature review or systematic review, there's a need for better reporting on toolkit development and testing so that we can all learn from it, and more and better testing and evaluation of the toolkit so that we can actually see how, whether they were fit for purpose and actually achieve what they wanted to achieve. I mean, it takes resources and a lot of time to try to produce those toolkits. And you look at some of the reports that's available, you know, a lot of investment in it in terms of people and time and money. So you know, we need to make sure that they're actually doing what they intended to do and doing it cost effectively in terms of the digital health intervention being successfully implemented or evaluated. So we'll leave it at that and open up for questions and comments especially.
All right, thank you, doctors. So we're now open for questions. If you have something you would like to clarify, please feel free to leave your message in the chat box so we can discuss them. Okay, so our first question is from Dr. Pradeep. So I just want to know, why does toolkits seem to come and go?
Does anybody want to comment? Myron, Sameera?
That's a really good question, Pradeep. I think it's because it depends on the need of the hour, so to speak, and then they're just produced because I guess producing and putting a document together is the easiest part, but it depends on how much rigor goes into putting a toolkit together. And as you can see, there were only 13 that we actually deemed, and we didn't even date this review. So this is like, you know, since whenever till last July, we just found 13 that actually are rigorous enough to be included. And again, most of them, we must be mindful, were implemented, and they were collated by really good organizations, including WHO and ITU, the NTU toolkit. But I suppose there's not been that much focus given as to a process of how a toolkit should be created, and maybe that's why.
To add on to that, thanks for the question, Pradeep. I think one of the facts is that one of the common kind of practice is that a toolkit, or it's a bit like a user documentation. You know, the view is that, and that it comes with the project usually. So it is an add-on. And that's one of the reasons I think why they come and go, because with the project. So, but we actually excluded these kind of very project-specific ones, unless they are kind of generic for, you know, kind of take a generic approach like the ones that we included. So to answer your question in terms of why they come and go, a lot of them are specific for purpose, that particular project. But they don't really call themselves toolkits. The toolkits that we included in this study are the ones like, you know, kind of that are like the genre that's presented by the Global Digital Health Index, or the used to be the survey questions, but survey done by the Global eHealth Collaboratory, along that kind of genre. And then we look at some of the ones that we included, that included the PRISM ones, which is looking at implementation and evaluation of systems. If we look at the measure, the one that's being done by the US measure and the evaluation group, you know, it's got general, and it kind of arose from, through, you know, evolved from the PRISM, and I believe that's from reading the literature, evolved from that, the PRISM group of work. And then they have a lot of very specific things like interoperability, you know, toolkits to help implement and assess and evaluate interoperability, and then quality assessment and so on. So if you look at and that's why the chronology of this toolkit development is important to understand. That they may not be coming and going, they may be evolving into something that's better. So I guess the short answer is, it's probably no real kind of development program or no real theoretical underpinnings for toolkits development in terms of these broad concepts of implementation of digital health intervention. or evaluation of digital health interventions. And so I guess, it is a long and roundabout way, but I think that's probably why they seem to come and go. So depend on how we define it, but also because they are evolving on the needs and how we actually are maturing in the way we use digital health interventions. I hope that answers your questions, Pradeep.
All right, thank you, Professor. So our next question is from Dr. De Castro. The question is, have you had any experience using any of these toolkits? And if so, can you briefly relate your experience?
My own personal experience is with that informatics capability maturity. That's what I have the most experience in. And the other toolkits, I've only just studied them. I haven't really applied any of them in the real world or in any of the projects that I have used. But I know of some of the applications in other projects, either personally through colleagues who have used it, but and also through the literature. So in terms of sort of coming in from the perspective of using the approach for informatics capability, which I guess we've kind of extended the work to use the term digital health maturity or capability maturity. It is how we actually develop the tools. So like we talk about what makes a good toolkit. And if we go back one slide, Myron, I'll go back to before that. It is the collaborative, that one, the collaborative process, right? It's important because whatever the toolkit, like for instance, even with the Global Digital Health Index, there needs to be a process where, if you're trying to measure national indicators, you go through with a interdisciplinary and interprofessional group, including the consumers. What are the indicators of how well the digital health intervention has been implemented, or the evaluation of it asking evaluators and so on. So there needs to be that process of collaboration, or what a lot of people are now calling co-development or co-creation or collaboration essentially. And a lot of times, if it hasn't been field tested or pilot tested before being released out into the wild, so to speak, you're going to have a lot of problems. And it's better to do as much testing as you can before you actually start to gather information using the toolkit to either measure how your starting point and measure the extent of the implementation, and to measure the impacts and the processes and the outcomes of the implementation. So and some of the approaches, again, it comes back to, so the actual intrinsic value of the toolkit itself, or the intrinsic property of the toolkit itself, but how people use it, or how people feel they own it, or how you locally adapt it in the co-creation process. And the other important aspect is also more or less cultural difference, in the sense that some people, it's hard, it's a top-down or a bottom-up approach to assessing the success of implementation or evaluation. You can say, and implementation has got to meet this criteria before it is considered successful. Or you can have a bottom-up approach and let the people who are doing the project define what is success. And I guess most people tend to use a bit of combination of top-down and bottom-up, the middle approach. So that's the other aspect that hasn't really been studied or implemented or used in the development and use of toolkits. So that's kind of my experience to answer your question, based on my own personal experience with using the tool that we adapted from the NHS from the UK. into the local Australian context, and involved a lot of that participatory process in terms of, you know, kind of how relevant is this term to measure this particular level of success and so on and so forth. And then before we actually start to apply the tool into into the project, you know, and it was to mature, to assess the maturity. And at the same time, you gather information on how useful and how to improve the toolkit. But and I, you know, and the more important thing is from our literature review that you really should report it. If you don't report it, nobody will know and learn from what you have done. So these are some of the kind of my experience with it, with using toolkits and tools. Does that help?
Dr. Casper says yes, Professor Teng.
Oh, thanks, man.
All right, thank you. To all our participants, if you still have questions, please feel free to enter them here. We also received a message from Dr. Gomindu, Professor. So for the benefit of those who are just tuning in, listening in, Dr. Gomindu says, I think it is important that academics do need analysis before developing a toolkit. It needs changes with time. We see a lot of digital interventions that were decided not important last year but became important this year, such as web-based education and telemedicine. We also have a message from Dr. Hasita. Highly agree to the fact that there should be better reporting on toolkit development and testing. Sometimes it is cumbersome for the researchers to probe how a toolkit is tested, evaluated, and what's the evidence base behind it. Some toolkits hardly describe any of those aspects. Can you elaborate a bit more about how you looked for such aspects during the literature research?
Do you want to comment, Myron or Sameera?
Yep, I think I'll have a go at that. Yeah. So when we identified the toolkit, one approach that was used was, I guess you could call it an ancestry and snowballing approach. That's the term that I've seen used in other systematic reviews. So I source the reference of that toolkit in PubMed, for example, or Google Scholar, and then look at papers that cited that toolkit. And in some situations, not all, it would take some time to peruse these references, but I'd be able to find specific examples of case studies that used that toolkit in their implementation. And so then we'd use those case studies as examples of implementation and or evaluation of a particular toolkit. So yeah, there is some process of going through references and finding out where toolkits were specifically used.
Yeah, to add to that, specifically used and actually tested and evaluated to see whether they're actually useful or not. I don't know, some of you may have been to our talk last week on the work maturity assessment work that we're doing in the Pacific. One of the big unintended consequences of tools and toolkits is the cognitive load and overload. You know, having a lot of them around, you actually can put people off digital health kind of interventions. I mean, all of us have bought either a software or an app or something, and the documentation is so useless that, you know, it just makes it so inefficient to use. And that's the analogy. All right, if we don't take the message, the instruction and guidance on how to use tools seriously, firstly, it doesn't get used properly the way you want it to be used. But secondly, it can kind of take us back in terms of progress of getting people to adopt the tool, in this case, the software tool, the digital health tool, as opposed to a tool or a toolkit.
All right, thank you,
So
Professor.
it's worth the effort, I think.
We also have a new message here from Dr. Tanvir. It would be a Herculean task to pull toolkits together and review and identify applicable building blocks. I'm curious to know if there is such an effort to pull together available toolkits in a centralized repository.
I'm sure some of you in the group audience might know more about this than I would. But there is I guess part of the digital goods initiative is to actually to include some of these aspects of what you mentioned. Now, that raises great, and there's lots of discussions. I remember having a discussion in one of the forums that AeHIN ran on, how should we classify the goods available publicly. And I think the WHO guideline has got some useful work on this. So I think there is some efforts going on, but I don't know if it's called bringing all this together. So in terms of trying to bring it all together, I think that's, we have tried in this literature review, and we found that there's lots and lots out there, but as somebody commented, they come and go. And they come and go because it's like apps, all right? They last 6 months at an average. And partly because they haven't been particularly well, number one, designed, and actually been tested with the users to get some feedback on how to improve it for the next lot of users or the users that come after them. So yeah, it will be a Herculean task, but I think if the will is good and we recognize that it's important to do, and that it helps the actual implementation and the diffusion of digital health technology that all of us are wanting to do, that if we don't do it, this particular guidance in the use and the implementation and evaluation, it's not going to help our cause. Sorry, yeah. That's my answer to that question. It's big, but it's worth doing.
Thank you, Professor Teng. The next one is from Dr. Gomindu. What is the best way of doing a needs assessment, qualitative or quantitative, and web-based or face-to-face?
That's a good question. I think the general consensus and the general kind of evolution of especially real-world research is mixed methods. I think I saw comments kind of being made. It's using a combination of methods, because you can survey and get quantitative values of how many people use it and what they use it for and so on, but it doesn't really tell you anything on how to improve it. You can have an indication that if more and more people are using over time, the chances that it might be a good tool, all right? But that's all you know. That's why the qualitative bit is important. It is not something you can have a big sample size, but you need to identify from the questionnaires, from the quantitative data, what are important gaps that you need to know, and then you have targeted sampling to try to answer those questions qualitatively, so that you can actually start to say, yes, this is a gap I can address, or this can be addressed this way or that way, and then we start to address it. So there's no one good way to do it. Sometimes a simple survey will help, depend if you just want to know whether what's the reach of the digital health tool, the digital health implementation you're evaluating. You just do a geographical survey, and then you start to know, well, it's reached people in so many so many districts, or it's reached the young and the old, or reach more men or women. So those simple surveys are useful, but they don't really tell you how to improve it. You need to talk to, say, do a focus group or something of women to find out why they are using or not using this particular tool. Especially if it's a maternal and child health tool. So those are kind of, that's a kind of the way people are progressing in terms of evaluating tools and toolkits, and for that matter, digital health interventions.
Thank you, Professor Teng. Dr. Gomindu is also saying thank you for the detailed answer. So far, there are no questions coming in. So if the other participants are still typing their questions, I would like to announce that we have a YouTube channel where all the recordings under the WHOCC webinar series is available. So if you want to check out our previous webinars with Professor Teng's team, you can check them there. And also the link that we provided in the chat box, it is relevant with this webinar, so you might want to check it out. Other questions?
I guess I've got a question. So the thing for you guys, do you think this method of including a toolkit, or and is fair? Like some of the things, the four toolkits that we thought were really good theoretically, but they weren't field tested at all. Do you think we should have included them, or could have, or we just exclude them and wait to see if they actually evolve to something that's been field tested and improved and so on?
Dr. De Castro is saying it would have been nice. I am interested in the mental health one. Maybe I can enable your microphone, doctor, if it's working.
Yes, I'm on the mic now. Thank you so much. It's an excellent webinar. And I had realized that, I guess, in order to go through like implementation of digital health, that these toolkits are very, very important, at the very least in the planning stage. So I'm interested in the mental health because it's an issue now, just like telemedicine is, and all these educational are not necessarily non-health, not necessarily health-related solutions, digital solutions. So yeah, it's coming up. There's a lot of mental health that is moving on towards the cloud or into digital solutions. And I mean, telehealth is being demanded now by patients. So yeah, I just thought that it would have been important, even though the mental health one has not been field tested. I suspect they may have some sort of like criteria that would still apply.
I can only say I agree with you. That
go ahead, sir.
Even just take an example, right? We're now in the middle of a COVID-19 pandemic. Even now, within the pandemic situation, there's lots of mental health problems. But can you imagine the long-term mental health problems, especially if we start to have wave 1, waves 2, waves 3, and so on, and so mental health is important. Not just, I mean, I'm just using it as a kind of extreme example, but it is a big problem. That's why there's so many manifestations of that. In terms of every chronic disease that we deal with, every kind of social diseases that we deal with have got the mental health elements. It is the biggest comorbidity, and that's why we were really interested in the e-mental health one that's done by the Mental Health Commission of Canada, and that's why we're kind of watching it with interest to see how it's going to kind of come up with that. It actually it'd be nice if they actually did an evaluation where they compared one of the tools or the toolkit, a situation where they actually use the toolkit with the mental health, particular mental health intervention, and see whether using the toolkits and the intervention, and using the just intervention without using a toolkit and just using normal ways of helping people use the toolkit, a tool, whether actually there's a difference in the outcomes in terms of improving people's mental health, or at least helping them cope with it better. You know what I'm trying to say here? Somebody was asking a question, is that it takes a lot of extra effort, but it could be part of the same evaluation or the research into that particular mental health intervention, as to see whether having a toolkit that can be used either by the project managers or the mental health patient themselves or the carers. So there's a whole different kind of range of ways you can approach how we can make our implementations, in this case in e-mental health, more effective. Essentially, that's what it's all about.
I think what you're, just a follow-up, I think what you may be suggesting is that for the users, such as the patients themselves, or maybe the clinicians, could use the toolkit to evaluate which of these digital health interventions would be appropriate for their setting.
Yes.
Correct?
Yep. Yes, but more, that they actually help the cause by saying that this particular toolkit or a toolkit, or which is done this way, actually improves the way I implemented it, and hopefully by improving the way I implemented the e-health strategy, the e-mental health strategy, actually improves the e-mental health of the patient, the mental health of the patient. You get what I'm trying to say here? That, you know, it doesn't take too much to collect the extra information to help us deliver implementations more effectively.
I see what you mean now. One last follow-up. Did you publish your work on evaluating the toolkits? Because it would be really nice for us to have a copy of the I guess if you publish the PDF, if you have it.
We will. Well, we're planning to. And so once we, you know, as I said, part of this webinar is part of actually sharing this with you and getting your input to see, you know, kind of whether we're hitting the right ballpark, you know, and getting kind of other ideas on the way the direction we're heading with this this particular review of toolkits. Yeah, no, we intend to, and hope, and we will share it through AeHIN and the WHO Collaborating Center.
Yes, thank you, Dr. De Castro and Professor Teng. I think there are no more questions, but Dr. Annie has shared the link in the chat box. It might be helpful for everyone. Okay, so I guess this wraps up the session. So thank you so much, everyone, for actively participating, and also to Professor Teng, Dr. Sameera, and Dr. Myron for joining us again. May we hear the closing statement, Professor Teng?
For me, I just saw an email from my colleague, my good friend, Michael Bainbridge. Yeah, I think, you know, yes, definitely, Michael, let's go for it. His comment was that how we can drive this, this particular aspects of toolkits and so on. And the hackathon shaping the new normal, digital against COVID, can be, and potentially produce a toolkit for some ADB, AIM kind of work on, well, not just COVID. I think the implication is, you know, COVID is a good example, but I think the implication is for good implementation of e-health, digital health intervention. So my closing remark is, there are lots of take-home message, lots of toolkits out there, but they need to be reported well. What's the evidence base? Has it been field tested, or better still, evaluated? And it doesn't take too much extra effort if you're going to evaluate a digital health intervention to actually test how you're actually implementing the digital health intervention. And toolkit is part of it. That's all I have to say.
All right, thank you so much, everyone. We hope to see you in the succeeding Mondays, same time, 6 p.m. Manila time, and good night. Thank you.
Thank you very much.
Thank you. Good night.
Thank you.